Welcome. Welcome to Consumers Doctor, Dr. Bengala. I'm going to give you a very important information today. This is a learning lesson for all of you folks. My number one priority is to bring transparency in healthcare. As a consumer's doctor, my goal is to bring transparency in healthcare. How we do it, it is up to you guys. What I'm telling you today, when you go to the urgent care, when you go on a telemedicine, urgent care, rehab facility, hospital, no matter where you go, very first thing is they ask you the insurance. Listen, when they ask the insurance, sorry, I didn't bring my card, I don't have it. As simple as that, folks. Don't give your insurance without you getting the cost. Then you ask them, how much is this going to cost before I give my insurance? I need to know that. This will transform the healthcare, folks. It's like any other. Every time you have an insurance, for auto insurance, you name it, for malpractice insurance, any insurance, it's a racket, folks. They want to see how much deep pockets you have. But that is not the point in healthcare. You need to ask upfront what this is going to cost before you even give your insurance card. This simple question will transform your healthcare, will bring down the cost. And you need to be upfront with any entity. I need to see the bill before you send it to my insurance. Make it a number one priority. Before you bill my insurance, I need to sign off. Otherwise, I'm going to tell my insurance not to pay for it. This will transform the healthcare. This alone will transform the healthcare, folks. I'm not kidding. We need to keep insisting on bringing transparency back. Anytime they say, how are you going to pay for it? How much is this? If you pay cash, it's 30 cents on a dollar, folks. When they say MRI is $5,000, that's a joke. It should not cost more than $500. If you pay cash, they'll do it for even lesser than that. This is where the healthcare is going. Every time you're in the hospital, do you ever see the bill before you're discharged? Never. Why is that? I still don't understand. When you're discharged, you're supposed to know the cost. Before you're discharged, you need to sign off before they bill your that is your insurance company. Don't send the bill to my insurance company without my knowledge. I have to approve it before you get paid for it. That's the way it should be, folks. If you really want to bring down the healthcare, that's the way it should be. Not without your knowledge, without your signature. Insurance companies should not be paying your bill. They have to agree with the consumer before they get paid. Folks, continue to follow Consumers Doctor. I'll keep coming up with the new updates and new information. You'll be surprised where we are heading. I'm going to transform this healthcare. I'm going to transform healthcare for good. Bring this affordability of premiums, affordability of costs, healthcare costs. We need to bring more transparency in healthcare, folks. That's the only way we can bring down the cost. Thank you for listening. I really appreciate it. I love you guys. I'll continue to love you. I would like to say we have a bright future ahead for healthcare. That's all I can tell you. There is a bright future ahead for healthcare. Let's make it more affordable, and take care of the folks who really need the health care. I'm more concerned about people who are economically impaired, physically impaired. They need the best care. Let's focus on them. Thank you for listening. Goodbye. God bless.